Hello, I'm Keith Baumgarten.
I'm a fellowship-trained shoulder specialist who's been practicing here at the Orthopedic Institute for 19 years. I am often asked about what is the best treatment for shoulder pain and rotator cuff tears.
Well, this is an area that
We've been studying and researching in depth here at the Orthopedic Institute.
the most common source
Of shoulder pain that a patient presents with typically comes from the rotator cuff. And rotator cuff surgery is common, with over 460,000 rotator cuff repair surgeries performed in the United States annually. Thus, many patients and even healthcare providers think that surgery is the only option for a rotator cuff tear. However, this is not true. There are non-operative options for the treatment of rotator cuff tears,
even full thickness rotator,
rotator cuff tears.
and I'm here to discuss
With you some of the research and data behind these options, so you can help give guidance to your patients that are seeking your help with their shoulder problems.
The Orthopedic Institute is a member
Of the Multi-Centered Orthopedic Outcomes Network, or MOON Group, which performed a large multi-centered study examining the effectiveness of physical therapy and a non-operative treatment algorithm to treat atraumatic full-thickness rotator cuff tears. We recruited 452 people across the country that have full-thickness atraumatic rotator cuff tear and treated them non-operatively. We followed them for 10 years to determine the effectiveness of a non-operative treatment program and the prevalence of patients crossing over to surgical treatment. At 10 years, 73%, the majority of patients were successful in avoiding surgery.
Interestingly, the greatest
Greatest predictor of patients failing non-operative treatment and choosing to pursue surgery was not factors such as high levels of pain, large rotator cuff tear size, or number of rotator cuff tendons torn, but actually the patient's expectations of non-operative treatment would be successful. Now, this study did select for patients willing to choose non-operative treatment. It was not a study that compared outcomes between non-operative treatment and operative treatments. To address this concern, the Orthopedic Institute participated in the ROSE study, which stands for Rotator Cuff Outcomes Work Group. This was a non-randomized prospective study examining patients treated non-surgically compared to those undergoing rotator cuff repair surgery. This study found that patients undergoing surgery had better pain and functional outcomes compared to those treated with non-operative options. Now, this study may have been affected by selection bias, since the patients and their doctors were able to choose which treatment options they preferred. The ideal study to determine which treatment is superior is a randomized controlled trial. The Orthopedic Institute is currently participating in a randomized trial called the ARC trial to help answer the question if surgery is superior to non-operative treatment for atraumatic rotator cuff tears. We have completed recruitment in this study and are awaiting outcomes once data analysis is complete. To summarize, physical therapy can be a successful option to treat your patients with atraumatic full-thickness rotator cuff tears, although surgery may provide better pain relief and functional outcomes. If you would like assistance in determining which method is best to treat your patient with a rotator cuff tear, please contact me at the Orthopedic Institute.
Thank you.